California's Children's Hearing Aid Assistance Program. Hello, I am Kevin Canals, an independent health insurance agent in California. And the state has a new program to help families with the cost of hearing aids for their children. Most of the information I am providing in this video comes from a webinar the Department of Healthcare Services did on this very program, the Hearing Aid Coverage for Children program, in September 2024. Here is the website that you can go to see more of the information. I will also be posting this to my website. So the program is designed to help families get hearing aids, pay for hearing aids for their children that have hearing issues. And I wear hearing aids, so I understand how difficult this is. So for children, the eligibility is between birth and 20 years of age. The child must be a California resident. Household incomes under 600% of the federal poverty level, and I'll get into that. The household does not have health coverage for hearing aids. They are not eligible for Medi-Cal, and the child is not enrolled in the California Children's Services for hearing-related conditions, because both of those programs will cover hearing aid expenses. And if the child, the household, has a health plan, private health insurance, the plan does not include hearing aids or limits annual benefits for hearing aids to $1,500 or less. So there's a couple different conditions, and of course this is a government program, so there's lots of conditions and you have to jump through some hoops. But let's look at the income. So they're saying 600% of the federal poverty level for the household size. So as the household size gets larger, the income that you can make also increases. So for a household of two, maybe just a single parent and a child, that household can have an annual income of $122,640 in 2024. Now, that's going to increase slightly in 2025. And then you can see for a household of four, the family can earn $187,200. And if you're below that, then you may qualify for assistance. Now, the other two columns, the Medi-Cal for kids, and so if your income is below those ranges for the household size, the children are automatically enrolled in Medi-Cal, so they would have the hearing aid services covered. Then the C-CHIP are certain counties that have a higher income level for the children to be Medi-Cal eligible, and that is San Mateo, San Francisco, and Santa Clara counties. So if you're kind of in that zone between Medi-Cal and 600% of the federal poverty line for the household size, you may be able to get some assistance. Now, you have to go through certain audiologists to get the treatment and do all the tests and everything to have them sign off that the child does have a medically necessary condition that needs the hearing aids. And there's not a lot of those providers around. I was kind of looking in the San Francisco Bay Area, and there's only 1, 2, 3, 4, 5, 6, within the area. That does not mean that the hearing aid specialist, the audiologist that you're going to, can't be involved in this program, but they're going to have to file some paperwork as well, because there are what they call treatment authorization request supporting documents. So for new hearing aids, the hearing aid prescription needs to be submitted and signed by the and with assigned medical history and physical examination, and signed audiologic report and hearing aid evaluation specific to the ear that needs to be fitted. And if you go to the Department of Healthcare Services website for this program, you'll see the different frequently asked questions. Are out-of-pocket costs covered? There is paperwork, and some of these questions aren't definitively answered because they do not know what your private health insurance plan may cover. Now, one of the things it says, if your child is in the California Children's Services, you don't want to switch to this hearing aid for children assistance program. And but they do have supplemental. This can be supplemental to the private health insurance in terms of covering some of those costs. And then, they mentioned, how do you find out about your plan's explanation of coverage? How do you know what your health plan covers? And that is always a big question, and I'll get into that. And do parents need to pay for out-of-pocket services? If the audiologist is set up with Medi-Cal, they're going to bill Medi-Cal direct, and so there won't be any co-pays or co-insurance. But if the audiologist isn't, you may have to pay up front, and then they can reimburse you on that. But know that the state does not reimburse the family, the parent, or the child. It goes through the providers. So that's why you need to work with a provider that is either already set up with Medi-Cal or is willing to take the steps to get involved with this plan. And on the website, there is a site for providers. Now, circling back to the health plans and what they cover, there is what is called an evidence of coverage or a membership agreement that you should be able to get or download so that you can go through and see. Now, this one happens to be for a particular individual and family plan through Covered California, and they do list prosthetic equipment and internally implanted devices such as the hearing devices are covered, but there may be some limits and there may be some out-of-pocket costs depending on the health plan that you have. And it is interesting, this particular evidence of coverage with this carrier has been updated for 2025 to note that hearing aids examinations appropriate for hearing aid for children, they are directing you to go to this program to learn more to see if the program will help cover the costs. And of course, we know that there are income limits on that. The enrollment process, you're going to have to fill out an application that's going to request income information, existing health coverage, and information related to the prescription of the hearing aids and a provider referral. So it's kind of like, which one comes first, the application or going and getting the prescription from the audiologist? And that's where some of these costs may be out of your pocket before it's reimbursed through the provider. On the website, you can download and see what the paper application looks like, but the application is online, and that's probably best to do it online. But there is a separate supporting document about the instructions, and they note in terms of the income that the family will have to supply pay stubs and potentially last year's federal income tax return to verify that the family is under 600% of the federal poverty level. And it is noted that there is an annual review if you seek to have other services covered in the future, additional testing or new hearing aids or something of that nature. So, but it's a good program if your child needs hearing aids and they're expensive, or a family that needs hearing aids and just hasn't gotten that because the health plan isn't going to cover a lot. This program may fit the bill for those individuals. So, for InsureMeKevin.com, I am Kevin Knaus.